Ladies and gentlemen, today we're talking about drugs, and there's a new drug that everybody's been talking about, Xylazine, that just dropped, and the streets are calling it Tranq dope. Tranq is a veterinary drug that's worsening the fentanyl crisis in America. From the New York Post, Xylazine is used for care in large animals such as horses and deer. By the way, while all the good stuff being used on horses, there's Tranq, there's ketamine, and there's ivermectin. The FDA said on Tuesday that it would more carefully scrutinize shipments of the drug into the United States to carefully check that they are bound for legitimate factories, pharmacies, and vendors. What were they doing before this? Because if they are only now carefully looking at shipments, what were they doing before? Dealers may mix xylazine into fentanyl to save money. Federal law enforcement authorities have said the drug known as Tranq, among some others, can be purchased at low prices from the Chinese. I mean, of course this drug is from China. Are we even surprised anymore? I mean, I can't wait for the Warhawks to go on the news and go, the Chinese are turning us into zombies. We need a new Beijing. That was such a terrible accent. I'm sorry about that. I just wanted to interrupt this program to say that this video is sponsored by Pfizer, and I want to thank the lovely people at Pfizer for giving me this brand deal, because I just called them and said I'm making a video about drugs. I'm making a video about pharmaceutical products, and they just gave me money. Also, they wanted me to remind you to get your COVID booster today. Now back to the video.
Making a difference. Brought to you by Pfizer.
Yeah, the street name is Tranq, and federal agents told us the drug has already made its way to New York City. It's mixed in the fentanyl and the heroin supply. It's eating away at people's skin. Mary Murphy joins us now at the preview of our special report at 10 p.m. Mary.
Hi, Corinne Tamsing. You know, my colleague John Frazzi and I have been in the news business for 40 years, and we've never seen anything like this. People on the verge of losing their legs or arms because this animal tranquilizer called Xylazine, or Tranq, is infecting their bones. They're now keeled over, as you said, on sidewalks along Kensington Avenue in Philadelphia because they're being heavily sedated by Tranq, which is mixed in with highly addictive fentanyl and heroin. Fentanyl may be driving the fatal overdose rates in the United States, but Tranq is leading to amputations because the people can't stop using it, and it's boring into their muscles and bones.
Next thing you know, you wake up with these big-ass holes all over you, these sores in your legs and wherever. They just pop out of anywhere.
Have the doctors told you that you could lose your leg?
Yes.
And that's not enough to get you to stop?
Trying. It's a lot easier said than done.
We would wake up and we'd be completely sick.
Have the doctors or nurses said that you could lose your hands because of the Tranq?
Yeah, I mean, there's a possibility. Yeah, it's a possibility. A lot of my friends have lost their limbs already.
You have problems on your legs?
I did, man. I had like a hole in my shin. There was a hole, man. I got in bed one night, man, and I was like washing my leg, and I could literally put 2 fingers in there.
Tranq is in 90% of the drugs that were lab tested in Philadelphia, and it's already here in the city, possibly in 25% of the narcotic supply in New York City.
I have two working theories on why Tranq has become more popular than fentanyl. Because we already knew that fentanyl was fucking insane, because you've seen the videos of what it does to people. But is it because fentanyl is not enough to escape the horrors of the world today? You know, there's the global financial crisis, there's the level of wealth inequality in the world today, there's the fact that every day there's a chance of World War III. We need something stronger, and that's where Tranq comes in. Or, this is my second opinion, this is what's more likely. Remember when your parents and grandparents started using Facebook and it became lame? I think that is fentanyl now, because there's these conservative squares on Fox News crying every day that we have a fentanyl crisis in this country. So, Tranq solves two problems. It's cheaper for everybody, and most importantly, it shuts up those cucks on Fox News.
Yeah, and Mark, as you mentioned, going into a great American city, it feels very dystopian seeing all those people, block after block, as you describe, bent over like that. And the mixing of the drugs that they're using, that is because it's an industry, it's a drugs market, and those that are making these drugs, pushing it onto these people, have found that this increases their margins. I mean, how much does this thing cost for these users?
$3 or maybe $5 for each hit.
$5 a hit and a better high. Now, I may be wrong here, but I think the positives outweigh the negatives. Sure, you might get a few limbs amputated because your skin has died, but diabetes patients get their limbs amputated all the time, and there is a fat person getting praised every day when she or he, I don't want to make this about gender, but mostly she, is eating a second bucket of KFC of the day, and there's someone yelling, "Yes, queen, you eat that second bucket of KFC." We should do the same for this. We should normalize this for drug addicts. Next time you're driving down the road and you see someone shooting up, you should roll down your window and at the top of your lungs yell, "Yes, queen!"